registrations have opened for the COVID-19 vaccination for all adults in India. But the government's dedicated website, the CoWIN platform, seems to be malfunctioning for many people. Many are complaining that the CoWIN site is not working. There are many who say that they've managed to successfully complete the registration process, but then there were no slots available. Now, until now, only people above the age of 45, healthcare workers, frontline workers were allowed to take the vaccine. As you know, from May the 1st, all adults in India are eligible to get vaccinated after the mandatory registration. Walk-in vaccinations for those below the age of 45 is not permitted. So you have to mandatorily register on the CoWIN platform if you are between the age group of 18 and 45 before you can actually go out and get your jab. Sunil Prabhu joins us from New Delhi. Saurabh Gupta, tracking the details of this story, joins us from Bombay. And we also have Sneha Koshi joining us from Thiruvananthapuram. Sneha, if I can come to you first. The CoWIN platform is not working for many. Many say they've managed to register but haven't got a slot.
Well, that's right. In fact, let me just give you right now, because for the past 20 minutes, around half an hour, I have been trying to get myself registered, but it's not happened. And right now, as we spoke, if camera person Babu can just pan in and show. So this is what the first time I have just been able to get my PIN code, and I have been able to. So now this whole thing of registering myself will proceed, and I'll be putting in my photo ID, my name, gender, year of birth, and all of that. So this is the first time that this is opening up for me. Till now, repeated attempts, and it was not happening. So at least this is one relief, that the portal is now functioning. We are getting the OTPs that's required. So that's one. And while I continue to register myself, a quick update on what the status really in Kerala is. At this point, we are not sure how many sites will be open for vaccination for 18 plus, how many vaccine doses will be available for 18 plus. What we do know is that the government has decided to give an order for 1 crore vaccine doses. At what rate are they buying this? That is something we will get to know post 5:30 when the Chief Minister speaks. Now, these are a combination of Covishield as well as Covaxines, and bulk of it is likely to be the Covishield vaccines. So this is what we know currently. How much of the available vaccines would be scheduled for 18 plus starting tomorrow is absolutely unclear. What we do know is around 2 lakh vaccine stock is available with the state. Around 71 lakh vaccine doses have been used by the state. It's a state with minimal wastage whatsoever.
Right.
So it's a little later, another 2 hours, that we'll get to know how many of this is slotted for 45 plus and 18 plus. Right. Starting tomorrow.
Sunil, the government's rules say very clearly that those between the age group of 18 and 45 have to mandatorily register. Their slot has to be pre-booked. There's no walk-in registration for this age category, for whom registration has just opened about an hour ago. Now, people who are facing technical issues with the app, one anticipates that will get sorted out. But what about people who've managed to register but are not getting any slots? This is the biggest problem, the shortage of vaccine.
That's right. In fact, it's, just to get to what Sneha was pointing out, I think the Health Ministry, as well as the various people who are managing the CoWIN, as well as the Arogya Setu app, have said that there has been a glitch. They've admitted that, and that's the reason why Sneha was able to log in now. But as you rightly pointed out, the big $1 million question is when will you get that slot? Now, there has been a complete mismatch in terms of what is the national requirement and what is the state requirement. Because state after state are asking. For example, Kerala is asking, Punjab is asking, Chhattisgarh is asking, and I'm saying these as opposition states, Maharashtra, where they have all saying that we cannot go ahead because of the fact that we haven't been given commitments in terms of how we will be able to roll it out. And that's the big mismatch that is taking place. This was to be the world's largest vaccination program, immunization program, call it as it may. But clearly, there have been a lot of mistakes, a lot of learning to take place. Hopefully, in the days to come, they'll be able to roll it out more smoothly. They will be able to iron out these differences. These teething problems are expected, but clearly, as a nation which has been fighting COVID, and as you see, it's become imperative for people to get this vaccination at the earliest. If India has to succeed, there has been a clear mismatch, and hopefully politics will be kept aside, and state after state, whether it is Congress ruled or opposition ruled, there will be no special preference, and everybody will get that much required while for them to get immunized against coronavirus.
Yes. Well, Sunil, just for a moment, the politics of the vaccination program aside, and we'll address that in just a bit. I want to just highlight what a lot of our own team members who've been trying to register for the COVID-19 vaccine are flagging at the moment. Saurabh, it very clearly says those who've managed to go through the registration process, they've got the OTP, they've uploaded the documents necessary. It says appointment for the age group of 18 to 44 is based on slots made available by private vaccination centers as well as respective state governments. This is something that the government made clear. Now, the COVID application very clearly says if slots are not currently available, it will be open soon, check again. So, the onus for this vaccination program to be executed essentially lies with respective states and private hospitals. The central government just says that it's done its bit by opening up registration.
Well, yes, I mean, the central government has made it clear that beyond the registrations, the functioning of these vaccination centers and the procuring, more importantly, of vaccine doses is going to be the state's responsibility, apart from the supplies that the center allots to states from its quota that it procures from the vaccine manufacturers like Serum Institute of India and Bharat Biotech, which are the two approved vaccines which are being administered across the country at this point. Now, the state in Maharashtra has consistently said that we have the capacity, we have the staff, we have, centers to vaccinate more people. Mumbai has been aiming to do 1 lakh vaccinations a day. But every time they try and scale up, the supplies fall short. And at this point, that is the biggest issue. Now, while Maharashtra says that it's setting up new centers, it's allocated 6,500 crores for procuring vaccine doses. The Chief Minister Uddhav Thackeray has been personally in touch with Serum Institute of India's CEO Adar Poonawalla. In all of this, the key question is, are there enough doses? And frankly, if you speak to officials off the record, the answer is no. From May 1, even if it starts, it is most likely going to be a token start, because it is only until the 3rd week of May that officials expect that they would have enough doses to start vaccinating the 18 plus category, 18 to 44 category. But that is the challenge that the governments of of various states are going to face, because while the center has opened it up by making the announcement, the execution, the implementation is completely left to the states, who are still struggling to acquire vaccine doses.
All right. So, it is in a certain sense a symbolic start for the registration of those above the age of 18. The execution of this, the availability of vaccine, the onus to procure these vaccines and disseminate it to the age group between 18 and 45, like Saurabh pointed out, the onus for that rests on the states. So, are states really prepared to do it? Do they have the wherewithal, the infrastructure, and most importantly, the time to do it? Remember, this category starts vaccinating from the 1st of May. At least that's what the government has said. Joining us on the broadcast, we have Dr. Suneela Garg, member of the Lancet Commission and the COVID India Task Force, also a fellow with the WHO and the ICMR. Dr. Padma Srivastava, Chief of Neuroscience Center at the All India Institute of Medical Sciences. Thank you, doctors, for being with us. Dr. Garg, I want to begin by asking you, the onus for this execution of this new phase of vaccination rests with the state. Are there enough vaccines in supply at the moment to be able to logistically implement this smoothly starting the 1st of May?
See, that's a big question. We have got 20 states as of now which have given a go-ahead for providing the free vaccination, and I'm sure the rest are going to follow soon. As far as, few states have got, like Delhi has already purchased 1.35 crore doses, and similarly, like Rajasthan is looking at 3.75 crore doses. So some of the states have already placed the orders. But as you know that this vaccination has got its shelf life, and it will be coming in a phased manner also to the states. But the best part is that the states have made up the mind that they will be starting from 1st of May the vaccination program, and West Bengal will start from 5th of May. That is there. So, I feel that, we already have the facilities which are providing vaccination from 45 years onwards. Okay, so some of the facilities will be created, from the government sides, which will be add on, but in some it can carry on. One will definitely have to have a review of the situation according to the different states, and also according to the places as far as number of doses are going on. Like yesterday, Maharashtra had done vaccination of more than 5 lakh individuals. So they have to think of, exactly having much more number of places and all of that point. But then as far as, initially you pointed out right, that, there is going to be a little vaccination crunch, because we are having 7 crore doses from Pfizer, from Serum Institute of India, and 1 crore from Bharat Biotech, which also will be ramped up very shortly to, about 11 crores by, Serum Institute of India, and again 4 crores from Bharat Biotech.
Right.
So, and plus we will get also Sputnik vaccine by 1st of May, but then that will also be started in a phased manner, because we have to look at, as this came under bridge trial, so 100 vaccines will be available and will be used in the first week to see that.
Right.
So,
very quickly, Dr. Garg, because you also understand the logistics of this, do you then feel that this has been reopened a bit prematurely? Should the government have perhaps thought of opening up vaccine for those above the age of 18 with comorbidities like it did in the previous category before opening it up to all? Because what we are seeing right now online, for instance, is this desperation to go out and register for the vaccine, many not being able to register, and many saying they're not getting the slots.
See, definitely it's a very, very important question from your side. But if you remember, you see, on your channel and on other channels also, there was a constant demand from the states as well.
Yes.
That we have to go from 18 years onwards. We must control the pandemic. So therefore, our young people are the ones you see every day. They are the ones, they have to go in and out, and they have to come back. So they will bring the virus and all that. We had that. And also I discussed with different, stakeholders regarding that. Why don't we have, the vaccinations first for people who are on dialysis, or who are got organ transplants, or the other people, who are suffering from blood cancers and all that. But then, when there was so much of demand also from the states, that I will say that it has not gone just unnoticed. You see, Center also has taken consensus of both states. They have not got a decision on their own. So that's where, at every channel, I remember that, and at every point of time during discussions, I heard this, that basically, Honorable PM should be opening this up. So that is there. So that's
well,
we should not be worried. We should not be worried. Okay. Any program will be slow, but make a steady start. And we will have much more number of vaccines, and corporate sector is also going to join us very soon. So we should not worry about this.
All right. Well, the demand for vaccination, you're absolutely right, Dr. Garg, has been a long-standing one. The question now is whether the supply can actually meet the demand, but you're saying it's going to be a slow and steady process. Dr. Srivastava, I want to bring you in, on another very important issue here, which is many who are due for the second dose of the vaccine are now fearing delays after the vaccine program has been liberalized, and doses will be made available to this other category as well. What would you like to say to them? Should they prematurely before the 1st of May go and get their vaccine? Should they not worry? What's your advice?
Thank you, Rishika, for having me on the show. So the first important thing is, a lot has been said about it. I'm not going to repeat on that. Vaccination is the biggest weapon we have in the armamentarium. So there is now literature which says that even with one single shot, you have a 50% chance of, decreasing the transmissibility of an infection into your own family. That is on one side. The other side is also that we need to prioritize the second shot. So if somebody has gone beyond the 28 days and within the next 1 week, they would be prioritized to get their second shot and finish with their vaccinations. Because remember, this is the group with a lot of comorbidities and a higher probability of a bad outcome. So that would stay as prioritization. As you said, as you told in your channel, that probably a token, start on May 1st, because in the conundrum of the number games of demand versus supply between different regions, this will be an issue. And you do not want to have a walk-ins and overcrowding also, because at this time, you don't want overcrowding as well. So probably go slow so that you're also avoiding the too much of gatherings in those shots in a panic to go and get the first shot. So prioritization will be for the second shot.
And I want to just reiterate this, Dr. Srivastava, because I think you make a very important point that overcrowding at vaccination sites and centers should absolutely be avoided, especially at a time when we are seeing the virus transmitting at the rate at which it is in India, which is why if you are between the age group of 18 and 45, you have to mandatorily pre-register before you can actually go queue up and get your shot. So that's very important to highlight and understand. Dr. Garg, what would you like to tell people? And there are stories that we've been highlighting from several parts of the country where the second shot is getting delayed. Now, we know that this is not an issue when it comes to Covishield because the window is between 6 to 8 weeks. But what about those who are scheduled to get Covaxin after a month and are not getting it immediately?
No, you see, with regard to vaccine, that is more important thing, that you see the more you space the vaccine. You see, in case of Covaxin also, we can space till 6 weeks, so that's not a problem, because the more you space, more better is the antibody response. And in Covishield, we were very sure, because you see, we saw that happening in the trial, where different doses were spaced at the second dose was spaced at different intervals, where you see the maximum interval provided a best response. So that was one thing. But in case of immunization for children also, that is true. The more we space, the better is the response, but we cannot space beyond a time. So I'm sure that this will be there. But one message to my young people will also be that whenever you go, you please should not forget your elderly and take them for vaccination as well, so that we in this bargain we are able to immunize people 45 years and above as well. So that should be taken as a responsibility, and follow COVID appropriate behavior and just wait for your chance. And do not mingle with anybody at that point of time. So COVID appropriate behavior at the vaccination site will be one of the most important things during the vaccination, after the vaccination, and you have to follow for times to come. That is important.
Dr. Srivastava, the other commonly asked question, and this is a lot of people are actually worried about being asymptomatic carriers of COVID. And, the rules and regulations, and doctors like yourselves have clarified several times here on NDTV as well, that if you are infected with COVID, you have to recover, wait for 4 weeks and then get the vaccination. What happens if you are, God forbid, asymptomatic, you're infected with COVID and you get the vaccine?
Right. Such an important question. I'm so happy you asked this, Rishika. You see, this vaccine, this virus is teaching us new things every single day. Yes, the current guidelines do say that if you are infected, then you wait for 90 days and then get it. If you're symptomatic with anything, like you have fever, diarrhea, you're on antibiotics, don't take vaccine and you postpone it. Said that though, there's also now emerging, literature which says that if there is an asymptomatic infection, and in fact, it was said on one of the channels today itself, that even after recovery from an infection, do you really need to wait for 90 days? You probably can take the shot. So I think there's a change. So if there is an asymptomatic person, he is well and he wants to go get a shot, I do not think there's a way, because we have not ramped up our testing so much. We can't say you first get you tested. It was there only in the trial. Like I was tested with an RT-PCR when I participated in the Covaxin trial.
Right.
Only when I was negative, I was part of the trial. But that's not possible in a rollout.
Yes.
So that will never be there. We will have asymptomatic people, but at this point of time, it seems to be safe.
All right. Thank you so much, doctors, for sparing your time and being with us on NDTV. Vaccination has registrations open for those above the age of 18. We'll continue to track the story very closely, the difficulties you're facing and any questions that you may have. Thanks so much for tuning in.